Our chief guest is Dr. Das sir. Our chief guest is Dr. Das sir. Welcome everyone. Our chief guest is Dr. Das sir. Our first session speaker is Dr. Reena Kulkerni ma'am. Second session speaker is Dr. Gujarati sir. MUHS has appointed Dr. T.Y. Swami sir as an observer. Hello, welcome everyone. Good morning and a warm welcome to all respected delegates and participants from all across the states. I, Dr. Preeti Sharma, first year PG Scholar of Kaumarbhritya Department, feels privileged to welcome you all on behalf of Kaumarbhritya Department of Honorable Shri Annasaheb Dange, Ayurved Medical College, Ashta, for national webinar on the Kaumarbhrityas 2020 Steps Towards the Healthy Child, an integrative approach of Ayurveda in Balchikitsa. In Ayurveda, before starting any program, we pray to Lord Dhanvantari. So let's offer our prayer to Lord Dhanvantari. I request Dr. Aishwarya Chiklikar for Dhanvantari's Thavan.
Yo Vishwam Vidudhati Pati Sattatam Samharayatyam Jasam Sruštva Divyamahaushadishcha Vividha Duri Karotyamaya Vibhramnonjalina Chakasti Bhuvane Piyusha Purnam Ghatam Tam Dhanvantari Rupamishamamalam Vandamahe Shreyasi Vandamahe Shreyasi Vandamahe Shreyasi.
Thank you, Aishwarya. With this graceful start, I request our organizing secretary of this event, Dr. Anjali Kamath ma'am, Professor and HOD of Kaumarbhritya Department, who have teaching experience more than 36 years, to give introductions of this webinar. Please welcome ma'am.
Good morning, everyone. I, Dr. Anjali Dinesh Kamath, Professor and HOD of Kaumarbhritya Department of Honorable Annasaheb Dange, Ayurved Medical College, Ashta, District Sangli, Maharashtra, welcome all of you for today's webinar. Kaumarbhrityam 2020, a step towards healthy child. I welcome Chairman Honorable Annasaheb Dange, Secretary Advocate Rajendra Dange, and Executive Director Professor R.A. Kanai Sir of Sant Jnaneshwar Shikshan Samstha, Islampur. without which this webinar wouldn't have been possible. I welcome Vice Chancellor Dr. Madhuri Kanitkar ma'am and all the dignitaries of Maharashtra University of Health Sciences, Nashik. I also welcome our chief guest, Dr. P.K.Das, our eminent speakers, Dr. Reena Kulkerni ma'am and Dr. Rahul Gujarati sir. I also welcome Dr. T.Y. Swami sir, appointed as observer by Maharashtra University of Health Sciences for today's webinar. Kaumarbhritya Department in Honorary Annasaheb Dange Ayurved Medical College has well qualified and experienced faculty. We have postgraduate courses since 2014-15. Suvarna Bindu Prashan, vaccination, health checkup camps are some of the few regular activities carried out by the department. We also have a neonatal care unit and IPD-OPD facilities. The two selected topics for today's webinar are continuously gaining more and more importance. Recent statistics shows that 5 in 100 children, that is 5% children, are found suffering from autism. So one needs to understand the disease and its management well. Panchakarma also is very important, especially in treating diseases where modern science or modern medicine does not seem to have an answer. I sincerely welcome all of you again. Now I welcome our principal, Dr. Ashok Wali sir, and request him to share his thoughts. Thank you.
Namaste. Very good morning to all. I welcome all the delegates. My dear friends, Sant Dhaneshwar Shikshan Sanstha Islampur, which is situated in the Sangli district of the Maharashtra state. It having so many branches, especially engineering, pharmacy, nursing, public school, international school, ashram shala. So many branches are there, around about 44 branches having Sant Dhaneshwar Shikshan Sanstha of Islampur. Annasaheb, Honorable Shri Annasaheb Dange Ayurved Medical College is one of the branch of the Sant Dhaneshwar Shikshan Sanstha Islam. On behalf of Honorable Shri Annasaheb Dange Ayurved Medical College, as a principal of this institute, I welcome you all. One more thing, that our college started in 1999. Now it is approved by the NCISM and is affiliated with the Maharashtra University of Health Sciences, Nashik, Maharashtra. We have a PG center. Also, we have a PhD center, especially in the all clinical subjects we have. We have very good research department through which the research is going on in all the departments. We have a very good hospital named as the Dhanvantari Hospital of 244 bedded hospital, having all the departments from the Balchikitsa, Balgo and Prasuti Tantra, all the departments with well-equipped hospital is there. We have ultrasonography, we have a dental, we have Shalakya Tantra separately, ENT department, Pathya department is also there. So many departments are there. Why? Because this is the one college in the Maharashtra which is accredited by the NAC and the gradation is the B+. Also, we have a ISO certified also. So, friends, Kaumarbhritya Tantra department doing a lot of things in our hospital, especially Suvarna Prashan. Since last 5-6 years, continuously the Suvarna Prashan is going on in our hospital. And also each and every year, we are taking a what we call that is a Sudrud Balak Spardha, means a healthy child So these so many programs going under the Kaumarbhritya department. We have very good NICU unit in our hospital, along with some modern doctors. They are also visited here also. So I welcomes all of you, especially my friend Dr. Das sir from the Yashwant Ayurved Medical College, Kodoli. He is a chief guest, sir. On behalf of Annasaheb Dange Medical College, I welcome you. Well-renowned resource persons like Reena Kulkerni from the SDM College, Bengaluru, and again my dear friend Mr. Rahul Gujrathi from Bharati Vidyapeeth, Pune. These are the two resource persons I welcome on behalf of my Ayurved college. MHS observer, Dr. T.Y. Swami sir, hope I also welcome him as an observer from the MHS. And each and every department is well equipped, especially in the Kaumarbhritya department. Dr. Anjali Kamath madam working as the head of that department. Also, all the departments we have fulfilled. Two readers are there, especially Dr. Babar sir and Bharmonda sir, and two lecturers, especially Reshma Dhere madam and Rupner sir. So, on behalf of Annasaheb Dange Ayurved Medical College, once again, I welcome you all, and I hope this Kaumarbhrityam 2022 will get some new dimensions, and it should be turns into the fruitfulness. Thank you. Thank you very much.
Thank you, sir. We are much obliged to your constant support and guidance. Today, we are glad to have some special guests with us. For that, I would like to request our HOD, Dr. Anjali Kamath ma'am, to introduce our today's esteemed chief guest, Dr. Das sir. Please welcome ma'am.
I am here to introduce our chief guest of today's webinar, Dr. P.K.Das, or Dr. P.K.Das as he is more popularly known. He has done his graduation BMS from Government Ayurved College, Puri, Orissa in 1992-93. He has done MD Kaumarbhritya from Gujarati Ayurved University, Jamnagar in 1996. He has also done PhD from the same prestigious institute, that is Gujarati Ayurved University, Jamnagar in 2006. At present, he is working as professor and HOD of Kaumarbhritya department at Yashwant Ayurved College, Postgraduate Training and Research Center, Kodoli, District Kolhapur. He has vast teaching experience of UG for 25 years, PG 14 years, and he is also PG guide for 10 years for Maharashtra Vidyapeeth as well as MUHS. He has also worked as examiner for PG and PhD in and outside MUHS. He has more than 50 publications to his credit. He has also attended and participated in various seminars and workshops all over India. He is also the recipient of Best Teacher Award in ATA Pune 2021. I feel immense pleasure to welcome you, Dr. P.K.Das sir, as chief guest of today's webinar, Kaumarbhrityam 2022, Step Towards Healthy Child. Welcome, sir.
Thank you, madam, for nice introduction. Am I audible, ma'am?
Yes, sir. Yes, sir.
Yes. Thank you, madam, for nice introduction. And I feel immense pleasure to be a chairperson in your esteemed institute. And
Excuse me, sir. I think your video. Yes, now it is on. Continue, sir.
Honorable Annasaheb Dange sir, the chairman of this institute, and Rajendra sir, honorable principal sir, and director sir. First of all, I would like to extend my hearty thanks for being appointed as a chief guest in your institution for this event of integrated approach of Ayurveda for Balchikitsa. So certainly this is a challenging problem in the society as well as for all of us, for all these physicians across the country. And as in Ayurveda, it has been mentioned that health is a complete state of physical, mental, social, as well as spiritual well-being. So our aim is to establish or ensure the total health, holistic health for these children by any means. As we know, the children are vulnerable and they are easily affected, and also there are more chances of the morbidity and mortality of the children if you are not taking care of it properly. So it has been rightly given the name of the webinar, national webinar, that integrative approach of the management, because we have seen that although the treatment is given in one area, so there are very chances of unsuccessful to this treatment. So in Ayurveda, as it has been emphasized, the main principle of treatment are Yukti Vyapasraya, Daiva Vyapasraya, and Swatha Vajayava. So to have all these three, and when we are adding all these three in the treatment protocol, in the principle of the management of a child, then the successful treatment will be there, and prognosis of that child will be easily available. So let me tell few words regarding the integrative approachment. And integrative management usually comprises of two things, that is conventional treatment as well as complementary treatment. In the conventional treatment, we used to give the only medicine, whatever is with us, and in the complementary medicine, we have to add something to that. That means we may use physiotherapy, acupressure, Panchakarma, massage therapy, and also there are other therapy like speech therapy. So by this way, we can heal the body, mind, and soul effectively. That's why it will be very much effective. So as there are two lectures which will be conducted in this webinar. First one is autistic children, and as this is a challenging problem, this cannot be treated well by the help of only giving medicine, because these autistic children usually occurs due to the varied etiology. 90% of the children are due to the genetic inheritance, due to the genetic defect, and 10% may be due to other factors. So both prenatal factor, natal factor, prenatal environment and natal environment and postnatal environment, all are usually essential. All are responsible for the manifestation of this type of disease. When we are talking about this autistic spectrum disorder, there is impairment in the language, communication, social interaction. In addition to this, there will be also some behavioral problems. Sometimes there will be hyperactivity of these children and the stereotype behavior. So, and these children will have no interaction with the surrounding. So there is very painful for the parent and physician. So in order to treat this condition, we need some more therapy. Yeah, as it has been stated here, is in the heading of integrated management. So in addition to the Ayurvedic medicines, by giving some medicines which can improve the intellect, the functions of the mind properly, we can have some therapy like hydrotherapy, touch therapy, sensory therapy, and we can also add something like some stimulation to that, sensory motor integration, sensory integration, auditory integration therapy. That will be very much helpful in this condition. There was one project which is, I think this is also continuing this project by Dr. Dinesh. He has included a very fine protocol in for the management of this disorder, autistic spectrum disorder, in the heading of Agastya protocol, because here he has mentioned something like that. In addition to the Ayurvedic therapy, he has also giving some training to the children and as well as to their parents in the form of some yogasanas and also some sensory stimulation. And in addition to this, dietic therapy, as this is also included in the complementary type of the management. So dietic therapy here, it is very much essential in this type of the treatment, because when there is increase in the toxins in the GIT, so that can also stimulate more, that can have the influence on the neurohormones. So again, it will increase the behavioral disorders of these children. So certainly, so this therapy, when is associated with the Ayurvedic conventional treatment in the form of Madhya Balya, that can have more effect, because Sattva has been also mentioned in Ayurveda, but these children are also very weak in these activities. According to their features, clinical features, we can divide this treatment in the different form. So it is not even uniform to all the children. So some children, school children will be also there, and some younger children will be there, and some adult children will be there. So the treatment protocol will be different in this condition. So it depends upon the one-to-one. However, only this condition can be prevented better, because the prognosis of this condition is not so good as compared to the other neurobehavioral disorders. As we know, there is a very fine, very nice description, very nice quotation given by Gabriel Mistral regarding the children. His name is today, because we cannot, the child cannot wait for anything. So early intervention and early treatment, whenever we are giving early intervention, there are chances of the improvement of these conditions are more as compared to the children which are diagnosed later. So early intervention and early treatment with this, all this therapy, both integrated management, including conventional and complementary medication management, that will be having very much good prognosis as compared to the children who are taking only medicines, Ayurvedic medicines. I have seen so many cases of this, at least nearly 10 patients who had come to our OPD, and also they are taking the Panchakarma therapy along with the medicines, so whatever the medicines, that is Madhya medicines in the form of Ghruta, as well as some medicines in the powder form that was given. And there was improvement of these conditions after giving the treatment. But after sometimes, if the patients are discontinuing their treatment, at that time, there is again a recurrence of these features. There are some patients who had improved in their language also in this condition, as this is basic problem of this type of the disorders. But after given the treatment, the various type of the treatment in the form of Sirodhara, Sirolapo, etc. So the patient had improved well, but it needs much patience by the parents as well as the physician. Both have to patiently deal with the conditions. So it may take 6 months, maybe take also 1 year. In this way, so I can also go to my second topic. That means whatever the topic is now today, that is Panchakarma. Panchakarma therapy that will be given by our other speaker. In Ayurveda, that means in Kaumarbhritya, Panchakarma has been advocated right from the birth. But our aim is to conduct this Panchakarma in the modified way, because the child are very delicate and there are every chance of damage, having emergency in these conditions. But we have to think whenever we are conducting the Panchakarma therapy, which amount of the Shredan we are giving and what amount of the Vasti, etc. Vasti, Virachon, these are given, whether woman is given, woman, when there is contraindication to the woman, whether woman is given to that patient. So we have to consider so many things. It is not like adult. So here in the children, according to their age, according to their condition, we have to think regarding their quantity and modification of the procedures. In this way, they can improve better. So mostly this integrative type of the management is very much helpful in the chronic cases, not like in the acute cases. And also sometimes as the name is integrated, we will also not forget regarding the other system of medicine for the diagnosis. In Ayurveda, for these conditions, neurobehavioral disorder, there are description as in Kashyap Samhita, in Lakshana, there are much description regarding these features, how to make the diagnosis of these conditions like ADHD, autistic spectrum disorder, and also some myopathic disorders. But we have to take the help of also modern medicine for the diagnosis, as well as for the particular, we can also do some management with the help of physiotherapy, and whenever there is acupressure and some dietetic therapy, yoga therapy, all can be included in this management. So if one wants to get the result effectively for the conditions like especially immunomodulatory deficiency disorders, so we can give immunological treatment. We can give immunomodulatory treatment. In addition to that, we can have Panchakarma therapy, and also sometimes, if necessary, yoga, pranayam. This can be very much helpful for these conditions. So we have two eminent personality in the field of Kaumarbhritya. So I think they will give better lecture on this both the subjects. Lastly, I'd like to once again thanks to the management of the Annasaheb Dange Ayurvedic College and organizer for selecting me as chief guest of this special national webinar. Thank you.
Thank you, sir. To differentiate complementary treatment, conventional treatment briefly, we feel immense gratitude to have you here today. You gave very fruitful approach, sir, towards steps towards healthy child. Thank you so much for briefly explaining it. You always have been a blessing for us, sir. Thank you so much. Proceeding further, I would like to invite organizing coordinator of webinar and assistant professor of Kaumarbhritya department, Dr. Reshma Dhere ma'am, to introduce our first session guest speaker, Dr. Reena Kulkerni ma'am. Please welcome ma'am.
Good morning all. Myself, Dr. Reshma Dhere. I'm assistant professor in ADMC Ashta in Balchikitsa department. I'm here to introduce our first guest speaker, Dr. Reena Kulkerni ma'am. Heartily welcome, Reena Kulkerni ma'am. Ma'am is presently HOD and professor Kaumarbhritya Tantra Department, SDM Ayurved College, Bangalore. She has completed her BMS from Kalabai Raveshwara Swami Ayurveda Medical College and Hospital, Bangalore. MD from Government Ayurved College, Thiruvananthapuram, Kerala University. She has completed her PhD at National Institute of Ayurveda, Jaipur. MHSC in Clinical Child Development, Medical College, Thiruvananthapuram, Kerala University. She has 14 years of teaching experience for UG and 10 years experience in PG. She has published more than 45 research papers in national and international journals, contributing author for 2 books of Kaumarbhritya. She has participated in many workshops and seminars as a subject expert and delegate. She is recognized as PG and PhD guide. Ma'am has various research projects. These are a survey on factors that trigger stomach shwasa in children between 5 to 15 years, funded by RGUHS 2020. Impact of Prakriti on nutritional status in children, funded by RGUHS 2019. Co-principal investigator for research on comparative clinical study on effectiveness of Ayurveda and medicine on iron deficiency in children of Hassan district, Karnataka. PhD research work on randomized control trial to evaluate the efficacy of Medhya Rasayan on academic stress and academic performance in school children. MD research thesis on a randomized control trial on efficacy of Vishagrita on Tamakashwas in children aged up to 12 years. MHSC CCD research work on study attainment of head control in infants attending tertiary care Ayurveda hospital. Member of research team on Swarnamrita Prashana. Ma'am's ongoing research projects are a clinical study to evaluate Satyavaman and Naimittik Rasayan effect of Chatusashti Prahari Pimpli in Kafujikasa in children of 5 to 15 years, and a survey study on risk factors of autism with special respect to Garbhopgatkar Bhava, funded by RGUHS 2021. She has won many awards such as PG research work awarded cash assistance by Department of Science and Technology, Government of Kerala, Best Doctor Certificate of Excellence for year 2013, 14, 15 and 16 at SDM College, Kaumar Ratna Award by Association of Ayurvedic Professionals of North America 2019. Welcome again, ma'am, and I request you to please continue your session. Thank you.
Good morning, everyone. Am I audible?
Yes, ma'am. Yes.
Yeah, audible, man.
Okay.
Audible.
Yeah, first of all, I would like to take this opportunity to convey my regards to the whole team, Kaumarbhritya, headed by Dr. Anjali Kamath madam, and very active Dr. Reshma Dhare madam, and all the staff of the Department of Kaumarbhritya from Annasaheb Dange Ayurveda Medical College and Research Center. And I also would like to thank Principal Sir, Dr. Ashok Wali Sir, for giving me this opportunity to share some of my experiences and some of the concepts which we are practicing regarding the autism in our day-to-day clinical practice. With these words, I would straight away would like to get into the topic. Thank you, everyone, for inviting me and for those kind words. So today's topic for discussion is PPT visible, ma'am?
No.
Yes.
No, madam. Please share the screen.
Yes, yes. Is it visible now?
No, ma'am.
Yeah.
Yes. Ma'am, need full screen.
Yeah. Hope it is clear now.
Yeah.
Yeah.
Okay.
Yes. Thank you so much, sir. So today's topic is transdisciplinary approach in the management of autism. Now, before getting into the topic, so far Dr. P.K.Das sir very nicely gave introduction about autism and what are the factors which are involved in possession of the autism and what are the things to be considered while managing the autism. So with that introduction, it is very easy for me to get into the topic. Now, coming to the topic of today's discussion. So there are two headings in this transdisciplinary approach in the management of autism. Now, autism, the brief introduction is already been given. So why transdisciplinary? Sir was telling that no single therapy is effective in controlling the autism. So ultimately, we need to, or we have to adopt the procedures which are from the multiple disciplinaries of the medical field, which can improvise the presentation, which can improvise the quality of life in the child. So whenever the combined efforts of various contemporary therapeutic modalities with a common goal, time-bound goal, in the best interest of the child is involved or engraved in the management protocol, it is called as a transdisciplinary management of autism. Of course, we being Ayurveda people, we need to head the team which treats the autism with the basic concepts, with the involvement of the other contemporary science, so that we can come out with the best results. Now, why this topic is so much of relevance in the today's era? We know that older estimates, corner when described, there were only few countable number of autism in the society as a prevalence. Now, it was in 1985, it was like 1 in 2,500 children were suffering from autism. Now, you can see slowly the CDC gives the estimates that 2002, it was 1 in 150. And the current prevalence, that is 2020 prevalence, as per CDC, says 1 in 54 children can present with the features of autism. So there's a lot of change is happening in the society. So there might be so many contributory factors, which is, contributing to the steep rise in the prevalence of the autism. Now, we also see that there are boys who are affected 5 times more as compared to the girls. And as sir was telling, the management cost is too much. When we interact with the parents of the autism, they spend thousands of rupees only in rehabilitating the child with autism with a few percentage of improvement, right? So it is estimated that $17,000 billion per year more we are spending to take care of an autistic child as compared to the normal child. These are the prevalences and the statistics from the CDC. That is, that gives us an alarming notion that yes, we are not yet prepared. We have to do something which is good, which can bring about results and which can relieve that pain of this whole family when a child is autistic. Now, moving on to what causes autism, because see, Karya Karana Vada, without cause, knowing the cause, we cannot treat. How far we can treat only the features. It is not going to be fruitful. So, what is the difficulty with autism is that even the cause is not established till now. Many pathways with most not yet well defined or developed or understood are explained in the contemporary science. There are association with the genetic as well as chromosomal disorders. In about 10 to 20% of autistic children, we see the genetic or the chromosomal involvement. So more so with the Down syndrome, Fragile X syndrome, it alone, 6 to 10% of autistic children, especially in boys, is alone contributed by Fragile X syndrome. And we have rare disorders like tuberous sclerosis that can present with autism. Then congenital rubella syndromes can present with autistic features and other genetic disorders. So there are copy number variant genes. They are the DNA segments, in fact. They range from several megabases among individuals. That could be because of the deletion, insertion, inversion, or complex recombination. This is the latest thing which is published in the Science Daily. And they also say that there are several neural ligands and shank. These are the genes identified. And the neurexin genes encoded proteins which are crucial for the synapses formation, maturation, and stabilization of the nervous system. And they are in fact responsible for the changes in the behavioral patterns in autistic children. So they have named it as NLGN3, 4Y genes and all. This is for just updation with the current science. And of course, biological and environmental factors are also contributing for the presentations with autism. So for example, exposure to the lead and the mercury in the developmental stages, or any medications is the mother is taking during the pregnancy. We have few cases, they reported that the mother was on some medications like prenatal stress, increasing parental age, and other health risk factors could also contribute to the changes in the biological environment which the baby is growing, and that can predispose for the development of autism. And the latest is one more thing, that they've identified 2 immune mediators associated with autism. They had surveyed for about 16, but out of that 2 are identified. So for example, IL-1RA, and that is interleukins, and interleukin-4 are associated with the presentations of the autism. So by and large, I would say these are all the proposed pathways through which autism can cause in a child. But nothing is solely identified as this is the de-risk factor for the autism. So the combined effects of all this, and we should not forget that not having a stimulating environment in the growing period of the child, and exposure to unwanted radiations, maybe, the gadgets, where the child's interaction with the societal interactions comes down, and sometimes that can predispose for a child to present with the features of autism. And with all this, we can say that the multiple factor, it is a multifactorial disease, and fMRI studies have also contributed that there could be variations with the amygdala, there could be hypothalamic variations, and these solitary or very discrete cortical changes. And even in the placental studies, they have shown that the hypermature placenta, and that which can lead to the oxygen therapies, during the early, that is the neonatal period, they also can substantially contribute to the development of the autism in a child. So based upon this, we need to plan our strategy for the management of the autism. There will be, in fact, it is a very famous question in the medical field, vaccines causing autism. So in the yesterday years, there was a notion that the MMR vaccine is the culprit which can cause the autism. But various researchers on the vaccine causing autism, they say that the thimerosal, which is used as a preservative in case of MMR vaccine, is a mercurial compound which is responsible for the causation of this autism. But a lot of studies, including the publications in the very finest journals like Lancet, JAMA, and FDA outrightly reject the involvement of the this association with the vaccine. They say that they have done a cohort studies, large cohort studies with the no harmful association between the autism with the MMR vaccine. Now, coming on to clinical perspective, what are the warning signs? When do we have to suspect that a child is suffering from autism? Any child is as per the American Academy of Neurology. So it says that any child with any of the following 5 symptoms should be evaluated for autism. What are the 5 warning signals? One is no babbling by 12 months. We know that by 6 months, the baby should be able to babble. This is a normal phenomenon in the development. But absence of babbling by the age of 12 months, no gesturing, pointing, waving goodbye by 12 months. We know that it's a hallmark of the development. At 1 year, the baby should be able to say bye-bye. But when the baby is not doing that, and there are no single words by the age of 1.5 years, that is around 16 to 18 months, and no 2 words spoken together spontaneously with meaningful by about 2 years. That should not be a repetitive parrot speech. It should be a meaningful speech. And any loss of previously acquired language or the social skill at any point of time in the early childhood development. Any of these 5 features, if we are coming across, so we have to first screen the baby for the autism. Now, this is the DSM-5 criteria for diagnosis of autism. I just would like to simplify this. There are deficits in social communication. All the 3 should be present, and restricted repetitive patterns of behavior, interest, and activities. That is, a lot of stereotypes and fixated interests, Then symptoms should be present in the early childhood, and they should together limit or impair the everyday function of the child. Then it makes the diagnosis of the autism. Just a pictorial representation of the same. A child with the social deficits, like, and emotional discordance, it's not expressing any emotions. So, for example, when the mother or the father enters or leaves the home, the child is may not notice whether they are coming or going. They are not at all having any response. Normally, a child, when they see that parent is moving out, it starts crying. Pick me also, I will also come with you. So this is the typical presentation with autism. And even if lot efforts, the child doesn't look into the eyes of the parent and talk. And child is always involved in his own world. It doesn't matter whether the other children next to it are playing, they are, making noise, they are enjoying. No, this child is always involved in his own world. So this is with regards to the social repertoire of the child. And it has a typical presentations, like, if you give a toy also, first of all, the child is not interested in the toys. If at all you give the toys, it has a typical way of playing. It keeps on just arranging or spinning or just rotating it and seeing, and it doesn't actually play with the toy. And it keeps on flapping, jumping, then, or else it gets a stimulation, or it gets calmed down only by rocking, right? So such presentations would be there. The child is present, fascinated with the lighting toys, that bizarre light which comes out, disco lights which comes out from the toys, and it keeps on watching this, or else it keep on flicking the fingers in front of the eyes and the mouth, right? So these are, and there could be extreme difficulties with these children, either in hair cutting or putting the cloths itself could be a very difficult task for some of these children. So these are some of the manifestations, which as mentioned in the diagnostic criteria as per the DSM-5. Now, let us move on to the clinical features. So clinical features, as told, it could be in the 3 domains, like social interaction difficulties, communication challenges, and repetitive repertoire. Now, how does by clinical features develop by around 36 months of age, as early as 1.5 years, and typically diagnosable at that age, and may be associated with some of the neurological conditions, as I explained earlier, something like seizures, tuberous sclerosis, and all. And how does the child present socially? As we were discussing, poor eye contact, repetitive activities, as in spinning objects. Then, the child would be looking at only one object, not interested in stories or other activities. It can shift or divert the attention, but that would be of a very short span. The child is, having the rigid routines. Say, for example, we had a child. He wants to wear the blue shirt always. Every day the child wants to wear the blue shirts. So, and follow the same routine. That means even if it is a holiday, child has to be taken in that road and brought back to the home. Otherwise, child will be very much agitated. So let us just have a visual presentation of the same. This is one of this child. He is around 5 years. You can see the repetitive movements in front of the eyes and the spinning of the pen. So even if you offer a toy, you see it doesn't play. It doesn't know how to play with that toy. So it is simply lining up or just moving, spinning the ball and enjoying. So this is how, this is a typical presentation with a repetitive repertoire. I'll show you another child. You can see here, this child is having a purposeless movement of the hand, rubbing the hand and moving it towards the mouth. So this is called as typical hand washing movements. And if you observe, at the end of this movement, the child makes a hard breathing, hard expiration out. That is called as sighing respiration, characteristic or diagnostic of Rett syndrome in a child. So this is how we will present with the children with autism are going to present. Now we'll move on to the communication as well as behavioral challenges. Temper tantrums, self-injurious behavior, hyperactivity, destructive behavior. So these are again hallmarks of some of the children associated with autism. Few children can either speak a few words, or they could be delayed or regressed languages, or some could be mute. As I was showing a video of that 7-year-old child. Now he is around, I think, 14-year-old now. He is better with his lifestyle as well as the quality of life. But the child did not develop the speech. Now he is on the alternative communication mode. So now, otherwise, the child can have a echolalia. Echolalia refers to the repetition of the spoken word. If I ask what is your name, child will tell what is your name. So that is called as echolalia. Then pronoun reversals. So it doesn't know the difference between he, me, she. So pronoun reversals will be there. And nonsense rhyming without meaning, they keep on making some noise, and there could be some neologisms. Neologism is the child may not be exposed to any particular language. They keep on speaking. It looks like that the child is speaking other language, but it is totally absurd speech which the child will be having. You can observe this video. This child is, in fact, it's a Malayali child, not exposed to Hindi language, does not even watch TV. So if you observe, she's speaking, she looks as though she is speaking in Hindi. But it is a meaningless talk. So this is called as neologism, and you can even see the repeated flapping and kind of activities with the child. This is another child who is presenting with an aggressive behavior, too much hyperactivity, and repetitive repertoires, you can see. Not even a few minutes the child is able to sit idly or sit calm. So this is a severity of the aggressiveness which the child is showing. Now moving on to cognitive abilities, intellectual impairment could be associated with most of the autistic children. And some of the autistic children could be, they could be having a savant abilities, or sometimes, they could be meaningless savant abilities. Savant abilities, I mean that they will be extraordinarily talented in any one of the field. If you are regularly watching, this Asian singer, there was one child, who in fact came to the finals. He doesn't know to write, he doesn't know to talk, he doesn't know the social behavior. But when he is brought to the stage, he sings. He sings even the classical songs as perfect as any trained classical singer. So that is the ability. It was a diagnosed case of autism. These children could have, and we have seen some of the children, they can talk a lot about satellites, they can talk about Mars, moon, everything. It looks as a very scientific speech when they speak about it. But the wholesome development is affected. So such kind of presentation could also be there. Now, how to diagnose these children? See, without diagnosis, we cannot move forward for the treatment, right? So how to diagnose? So we get a lot of children with the speech delays and loss of speech, slurred speech, expressive language disorders, receptive language disorders, so many, associated with speech, communication, and sometimes, associated with other disorders like, mental retardation, secondary to seizures. Many children we get, they can also come with the complaints of speech, right? So we have to filter them. So a very simple and very useful handy screening tool for any practitioners is MChat. MChat is globally accepted diagnostic tool for children, screening the children with autism. So it's a free resource available. You can just click MChat R, that is the reviewed MChat questionnaire. There are 20 questions, and administration as well as the how to scoring systems, everything is given in that. So any child who is presenting with a scores which are greater than 3 needs to be reviewed after a month, or those who are presenting with the scores more than 5 or 6, the moderate risk of autism, they immediately needs to be put under the systematic protocol for the management of the autism. Next, to confirm the diagnosis, MChat anyway is a screening tool for any practitioners who can screen this, and they can refer it to the specified persons who can manage with the autism. So you have the DSM criteria and ISA, Indian scale for assessment of autism. Is an Indian scale. It's a highly specific scale for assessment. It takes hardly around 15 minutes for us to assess the autism. And of course, final is CARS, that is Childhood Autism Rating Scale. We can just CARS needs a training, license to assess the child. So these could be definitely used in the clinical setup to assess the autism. Now, moving on to the principles of management. And now we know that the child presents with a varied presentation in the form of social, language, repetitive repertoire, poor eye contact, abnormal language, poor cognition, sensory systems. You can see in the picture, a few children are so much sensitive to high-pitched sounds, or even talk itself. They immediately close the eyes. They are fearful to go to the area which is noisy or where too many people are there. So they usually present with sensory issues. Few children doesn't like to be touched, So such presentations, few children would like to roll on the floor because of its, the soothing cold nature. So like that, sensory issues would be there. So what are the management principles in the current science? So we need to constantly stimulate the child to get a meaningful attention of the child and to improve the eye contact, and interventions to improve the cognition and behavior theories are also available. Sensory integration, very needed. Then they have some alternative teaching methodologies also, like, teach technology as well as applied autism behavior analysis and treatment. So then rehabilitation, okay, in people who also treat with the multiple disabilities. Then medications like, the standard prescriptions include, serotonin reuptake inhibitors, then antipsychotics like risperidone in a very aggressive and very hyperactive child, and stimulant like methylphenidate. And so these are some of the medications which are frequently prescribed in the alternative system of medicines. But the results with all of them remains still very minimal, or sometimes the children initially show a good response, but related other effects of the medications, and once the medication is withdrawn, a rebound presentation of the symptoms. So these are all the some of the deficits, or some of the difficulties with which the parents and the children with autism face. There are some more unconventional therapies like the nutritional supplements of multivitamins, zinc, pyridoxine, magnesium. Then elimination diets also been proposed, like gluten-free and milk-free, that is casein-free diets, immunoglobulins, then secretin therapies, chelation is also available. Then auditory integration training, facilitated communication. This is what is available technology to treat the autism in the current era. Now, we being Ayurveda people, we need to look into what best we can offer. So when the alternative system is also looking into the traditional world, what best we can offer, it remains our responsibility. Now, when we know the autism as a disease is not described in our classical texts, so we don't have a direct and explicit description. So using the Charaka's methodology of identifying a non-specified disease in the Samhitas, like Vikara Prakriti, Adhisthana Antarani, and Samuthana Visheshas have to be considered. And with the available knowledge and applying our this knowledge into this what is that? Nahi sarva vikaranam namatvosti trivastiti. So with this principle, we can classify that there are a lot of garbhopaghaatakara bhavas. Then there could be some exposures, or the heavy metal poisonings are also identified. So there could be Vishagara Sanghata, and there could be Agni Drishti is the typical presentation in case of autism. And there could be some other diseases also they could have impacted. And with all this, what is happening? The pathology is either at the Bija dosha, that is at the Bija, or at the Atma Karma, that is in a specific expressive genes could be affected in a particular child. And there could be Ashaya Drishti. This remains to be one of the majority of the causes could be because of the Ashaya Drishti, that is the in utero environment and early developmental stages. So the exposures could have been affecting the child. So whenever all this happens, there's possibilities of, because in a very early stage, when a structure is getting hampered, so there's always possibility of involvement of all the three doshas is too much, with the relative predominance of whichever dosha is involved. So now, as we have discussed so many presentations of autism, this could be classified under the 8 major headings. This is called as Vikara Prakriti. So these headings include social interaction, communication, mannerism, resistance to change, unusual attachments, acute emotional reactions, intellectual impairments, behavioral symptoms, and physical conditions. And when we look into the classical text, we have beautifully explained the concept regarding the Unmada. He says these are the 8 bhavas which are affected in the manifestation of Unmada. So for example, Unmadam Punaha, Manobuddhi, Sangna Gnana Spruti, Bhakti, Shila, Cheshta, Achara, Vipramam, Vidyat. If you just go a little deep into these factors, we say that the child with autism has gnanasya bhavo abhava evacha, is the presence of manas. So this child is either perceiving things abnormally or there is no perception, improper speech and emotions, how to react, how to express. These are the difficulties of the child. And he cannot have a differential abilities to identify, analyze a situation and act accordingly. So there would be a poor comprehension, abnormal, untimely laugh, smile, rage, and child doesn't know how to react and how to answer, how to behave in a given situation. Then Sangnagnana is regarding the knowledge by means of name, sensory faculties, as well as time, place, this orientation. These things are invariably affected. Sensory faculties means gnana through whatever the sense organs we are achieving the gnana with the help of manas. So that is also getting affected in these children. And memory, as I said, there could be some 7 abilities in these children. As somebody is having too much knowledge on music, somebody is having too much memory. They can remain years together where they had kept a toy, and they go to the same place and identify in front of the toy. So like that, abnormal memories could be that. Bhakti, unusual attachment, desires for cold items and all. We see normally these children having a piece of a polythene cover, playing with that, having a empty toothpaste cover. They are too much attached to such kind of things. Similarly, Sheila, Sheila refers to Sheila Manushilanena, Bhaktim et Abhiprayate. Whichever we crave for repeatedly, that is called as Bhakti. And that shows our interest or attachment to that. Sheila refers to whichever we put into practice. We repeatedly put into practice, that is called as Sheila. So these children have a typical habits of, fixed rigidness and intolerance could be there. Then the repetitive repertoires, okay, or a few children are not liking to wear the clothes, the nakedness will be there, loss of sleep. So these, because they want to keep themselves awake in the night, they don't want to sleep. We had a child, it was a hell for those parents. I'll show you the video of that child a little later. Then regarding the cheshta, various abnormalities with regards to the gestures and activities are the hallmarks of autism. So achara, we have harmful behavior, social withdrawal, hyperactivity, over or less eating, vomiting, recurrent gut issues. These are all the variations which we see with regards to the autism. So more or less, they are the presentations are going in hand with those presentations with the autism. It may not come under any special category of the autism which are described in Chakra. But when you consider the doshic diagnosis of the Unmada, so Vata-Pitta predominance could be very frequently seen in case of hyperactive children, or those children who are submissive, little could be identified in the clinical practice. Now moving on to the Adhisthana, considering all the factors, we know that physical development of this child could be very normal except for the speech and language. So they shows that the higher mental faculties or the involvement of psyche is comparatively more as compared to the physical development. So now, higher mental faculty, when we speak, we have to speak about prana, udana, sadhaka pitta and tarpaka kapha. Invariably, all the functions which are related to these are affected, and Indriya prasada, Indriya tarpana is also affected in these children. And invariably Agni Drishti. Without Agni Drishti, there could not be any disease. Even though it presents at the level of the mind, we can see a lot of gut issues with regards to autistic children. We'll come to that little later. So what happens whenever the basic Agni, Agni is responsible for any health or ill health in a person. That is because the doshas and the rasa, in fact, which is the nutritive portion of the body for any dhatus, is derived from the Agni Vapara. If Agni Vapara is affected, invariably Rasa is affected. Rasa is affected, then influences the mind and its activities. So we have a chain link associated with the Agni Dushti. So, and once the Agni Dushti is there, Dhatu Sara get reduces. Dhatu Sara affected, Ojas gets also affected. So, what is a health? What is an interaction of a person is always, it is the best equilibrium status of dosha, dhatu, mala, along with the ojas and sattva. So when these factors, the physiological factors are kept in equilibrium, so they tend to stimulate the normal functioning of the indriyas, may it is karmendriyas, gnanendriyas or upayendriyas. So this portion is affected. And in fact, when we speak about, now this concept is deeply engraved in me after having long interactions with Dr. Prasadyam. Sir is too much, experienced, highly qualified and highly experienced faculty in the, though he is a Shalakya person, he is known for his management with the autistic children. So he has his own protocol called as Symmetry protocol. Sir keeps on highlighting that unless until Agni is corrected, unless until the Ojas is corrected, so we cannot manage the autism. And it is very true with the clinical experience also. And we are very sure regarding, I think everybody is very sure regarding the Ojakshaya Lakshanas and Ojo Visramsa Lakshanas. If you just recollect the Ojo Visramsa Lakshanas, say that there's a Kriyasa Nirodha, Sandhi Vishlesha, Dosha Chavana, and these are all the things, which are typically highlighted in the manifestations of the autism. So we need to be very specific regarding assessing the Agni of the child before starting the treatment of the child. This is just a schematic representation of the Samprati, which I have done based upon whatever the concepts we have discussed so far. Then moving on to very crucial thing, Samprapti Vigatana before planning the treatment. So we know that what are the doshas involved? Predominantly, all the three doshas are affected because it is an engraved pathology, either because of the genetic reasons or very early stage the doshas getting affected. So predominantly the doshas would be involved with the relative predominance that we have to assess based upon the case to case. And of course, sattva bhavas are reduced, so rajas and tamas predominance will be identified. Then dushyas, predominantly it's the rasa, and sometimes it could even vary with the etiology. So for example, if I speak a case of tuberous sclerosis, involvement of matcha has to be highlighted. So like that, relative, the involvement of the dusya could also be assessed based upon the case. Then Agni, invariably Jatragni is affected. Srotas is Rasava Srotas, Manohava Srotas. Adhisthana is Indriya, Manas and Hridaya. So Sharirika Adhisthana is not too much highlighted because, the Manovapara and Cheshta and Buddhi are the major things which are affected in autism. Then Rogamarga is Madhyama Rogamarga because of the involvement of the higher faculties. Then Vaktasthana, Manovapara and Sharira Cheshta. When it comes to the Rupa, we have already discussed regarding the Vibram of different 8 faculties with regards to the Unmada Chikitsa, as well as there could be associated Apasmaraka and presentation, Mura Chetas, Agnimanda, Ojakshaya, these could be the features. So now moving on to the management principles. Invariably, since the Agni is affected, Agni Chikitsa is the first line of treatment, then followed by Shamana Chikitsa for a period of time. Once a desirable degree of control is achieved, we can take the child for Panchakarma treatment in case of fully blown disease, or else the supportive therapies as a part of Panchakarma we have to adopt, and this works wonder. The supportive therapist works better than the Shodhana Chikitsa, especially in case of autism. Then apart from that, once the dosha samhita has to be achieved, though it could not be absolute, this one, we may achieve a degree of control, and that has to be followed with the major rasayanas. And anyway, the ultimate aim of the treatment is to improve the ojas and the proper functioning of the indriyas, and balya therapy, balya and rasayana for the child. And of course, associated with abhyasa has to be done. Then only it makes a in transdisciplinary or multidisciplinary treatment. Otherwise, we will not end up, 1 + 1 makes 2. Otherwise, we remain in 1 only. So that is what is the importance of a transdisciplinary approach in the management of autism. Now, Chikitsa principles, as I was telling, there is involvement of 3 doshas, and based upon the avastha, there could be sometimes vata predominant, sometimes kapha predominant, or sometimes pitta is vitiated. So accordingly, we may have to adopt the Vattasa Chikitsa without disturbing the other doshas much. So Unmada Chikitsa invariably is required to bring back the manas into control and in a healthy status. Then Avastika Chikitsa as per the dosha, and Sthanika Chikitsa has to be done. So this is, could be simplified based upon our professional expertise or the best available researchers and individual characteristic of a child. When we conglomerate all these things, this is what we feel that this has to be adopted in every case-to-case base. You cannot generalize as common protocol. Common protocol is for the major things, but for a child specific, we may have to make a certain variations with regards to the medicine. So for normally what we do in our, like we have a Sambodhi autism clinic in our hospital. So what we follow in our Sambodhi protocol, just explain to you. Then Agni Chikitsa, for Agni Chikitsa, the first and foremost thing, why Agni Chikitsa has to be done? Unless until Agni is corrected, unless until the baby's gut is calm, the baby will not give us attention. So once the baby's gut gets calm, baby gives you the eye contact, otherwise no. So it is the first step in getting eye contact. Eye contact is the first step to teach the baby anything. If the baby doesn't give you eye contact, how can you teach, how can you train, how can you make a child do any purposeful activity? Not possible. So Agni Chikitsa is the first line of treatment. So we should include the Lagu Ahara. Lagu Ahara here, case to case sometimes varies. We have children, though it is generally said that gluten-free diet. We have children that they are very calm with even with the wheat products and things, gluten diet. But there are children, they even half a chapati can disturb their gut for a week's time. So such children also we have attending our OPD. So case to case base, we have to select the food. But anyway, invariably it should be Lagu Ahara, which is not putting a lot of pressure on the Agni. And Lagu Ahara in the sense, we normally advise them to take predominant of red rice, ganji, red rice food, reduce refined sugars, then of course the wheat and maida, these things we allow them to have a little bit of curd or buttermilk, but no milk again, right? So these things, you may ask me, curd is guru than milk, why you are advising? So we'll come to that, to calm down the gut, the curd, that especially the Madhura Dadi, which is freshly prepared, that is better useful. But if you take too much sour, and that is going to be disturbing for the children. Then Rajanaji Churna and Ingvashtaka Churna are the first line of choice, followed by Vilvadi Gutika or Tushi Vishari. So these, things we start for the stimulation of the Agni. And based upon the case-to-case and the availability of the medications, even Kalyana Valeha Churna or Saraswata Churna excellent results. They do stimulate the speech as well as there's very good Agni Deepana and Pachana in nature. Then apart from this, Arvindasava and Kumari Asava, we give a list of medications. Why this list of medications? This again, based upon the child's compliance. Few children, they do not take powders. Few children, they don't like the lickable things. So that times we may have to alter our presentations. And sometimes even if we use Ingvashika Churna or Trikota Churna, that also irritates the gut. That makes us, it's a very challenging thing. So then what we did is we started using very simple things like Jira water, like things. So they act both deep and Pachana, and they do act at the level of the Ojas in a long course. So these are the things how we have, started using various medications in the initial stage. Then followed by Shodhana. Shodhana, as I said, Shodhana is not an initial choice of treatment in case of autism. Except if the child is in full Vataja Unmada Avastha, of course we don't give Shodhana, we give Snehana. Bahumatra Snehana, it calms down the child very much. It's a full-blown Vatika features. Otherwise, Shodhana is not a first line, neither Snehapana is the first line of treatment here. Then Madhura Vamana, if Mrudu Vamana, if it is the child is presenting with too much tamasika qualities, and if the child is compliant with the administration of this. Otherwise, we may give this as a lickable once or twice, thrice in a day. So the child would have a little bit of vomiting. So that could be done for about 2 to 3 days to achieve a fair degree of Shavan. Followed by Tarpana, that is Samsarjana Krama. Then Virechana is we use usually Trivratleha or Avipatikara Churna to bring about the Mrudu Shodhana in case of children with autism. Then Shodhana Basti we normally practice in a little later stage. A little later stage, not the initial this one. Then children, even with all this, if they are not giving good response, sometimes we use Tishna Sangna Prabodhana Nasyas in the form of sorry. Tishna Sagna Prabodhana Nasyas with the help of Vachadi Churna, Kachuradi Churna, or sometimes Lashana Swaras also we use. The dose will be very less in case of Sagna Prabodhana or Pradhamana Nasyas. Hardly we use 1 to 2 pinch of these powders. Or Lashana Swarasa, we can use about 5 to 6 drops of Lashana Swarasa to be instilled in the nostrils of the child. And again, it is, initially it is such a cumbersome procedure to make the child to lie down and cooperate for the treatment. So initially, we don't go with any of these things. First thing is calm down the child with the help of Agnichikitsa and some of the procedures which could be done at home by the mother. So once the child achieves a fair degree of control, then we add on, going on adding the medications which are Medhya, which is, Sangna Prabodhana, which are calming down, which are Pittahara, sometimes they are, sleep inducing, these things based upon the child's need. The child sleeplessness is the reason for hyperactivity. You have to give something which calms down the mind and makes the child to sleep. So, for example, we use Jatamamsi in such conditions. So, for example, Brahmyadi Kada extensively practiced in Maharashtra, which contains Jatamamsi. It induces sleep. Our patients have reported if we give this medication, you will be drowsy, and you will be irritable. So then We use the Mridvikadi Kashayas to improve the Agni as well as calming down effects. Similarly, the Kashayas are the initial line of prescriptions. Again, Grutas, if it is too much hyperactive conditions, preferably rather than Brahmi or Kalanaka, we prefer to start with the Mahapitta Gruta, so that calms down in a better way. Then followed by the use of Brahmi or Kalanaka. Arishtas, based upon the cases we would select. Kumaryasava, has a wonderful effect. Initially, it can act as a dipana, it can act as pachana, srotoshodhana. Too many benefits with this. We may start using Kumaryasava right from the first stage of the treatment. And finally, once the child's child is calm and eye contact is better, then we want to improve the Dhruti, Smriti and the other functions and immunological things. We would definitely add using Kumara Kalyana Rasa or Swarna Prashana Yoga. In certain selected cases, use of Bilva, we have found excellent results with the use of Bilva, especially children who have a lot of gut issues, the vomiting and bloating. So such children, they respond very well when we use Bilva. Bilva, the Amara and Agnidipana effect of Bilva is very well known to everyone. Then Sthanika Chikitsa, and as I said, this is the nice protocol for any Ayurveda practitioner. Without this, it is difficult to manage a child with autism. I just would like to say this because of the lockdown, and when we stopped the procedures, we had frequent calls from the parents. Without this treatment, it's very difficult to maintain the calm in the child. Please start, at least take a special permission for our children and do this. This was the kind of demand which the parents were asking for. So the first thing which I would like to highlight is the Murdini Taila, and that is Shiropichu. It can be done either as Shiropichu or Shirodhara for these children. Normally what we do when we start with the Agni Chikitsa, we ask the mother to do this particular procedure, either to massage the child with the powder of drugs like Trifla Churna or maybe the Eladigana Churna, or sometimes we may even give Siddharthaka Churna to just stimulate them in the daytime before the bath, and evening times we ask them to give a gentle massage on the scalp and the extremities so that the child becomes little calm and he would be responding in a better way. So this gives a fair degree of improvement for this children. And once that is attained, the child would be asked for once the Agni improvement. How do we assess the improvement in the Agni? That is also important. Once we start, usually it takes about 2 to 3 weeks time. Few children take some little more time, but usually 2 to 3 weeks time to present with certain features like the glow in the face improves. The child starts asking for food. If not, doesn't ask, the mother, he will take the mother to the food and would ask timely for food. And there will be normally these children can have either constipation or loose to such issues. So those issues get resolved. So there will be frequent the bowel habits will be corrected for the child. So the child feels comfortable and child's sleep quality improves. So may not be too much greater extent, but to a degree sleep quality improves. So these are the things which say as yes, there is an Agni Diti, we can take the child for the next stage. And the next stage of treatment is mostly the hospital based. And this treatment, again to concentrate regarding the sensory issues for the child. So again, here we don't go with the Agasmihapana or the Brahmana line of treatments. We just go with some varied sensations, rough kind of treatment like Parisheka is the choice of our drug, therapy, which we do for these children. And few children, we start with Nasya based upon the case. Otherwise, we continue with the Parisheka and Shiropichus. And at this time, we add them the Shirolepa. Shirolepa usually, as said, Bala Panchakarmas like, Chandana, Ushira, Ribera, then this kind of Eladigana Dravyas, or we have Bala Sohaladi Lepa described in Arabic Kalpadruma. So these are the drugs we usually select, or simple, Rasta Amalaki Jatamamsi. So whenever no other medications are available, we simply use Amalaki and Jatamamsi to put the Shiralepa for these children to bring about the calming down effect. Once that is, this I'll come back to this slide little later. So once that is attained, and the child's sensory issues. How do we know that the child's sensory issues are reduced? Then I was sharing with you, we had a child who never used to wear the cloth. Wearing cloth was too much disturbing for him. So when we started with this Udgarshana and Parisheka, then that issue was resolved. But then he became adamant to wear only blue color dress. Right, so then we introduced some Vahana, that is Mrudu Abhyanga, so for this child. Now he doesn't have that issue now, he is out of this issue. So such kind, the changes. The child was earlier not allowing to feed him with a liquid appetite. Now this child also we had. So we started with local rubbing in the mouth and the facial stimulation and all. So then slowly these issues were resolved and the child started eating better. So we know that those symptoms getting slowly resolved. Once that happens, we can definitely go for the next step of treatment for these children. So next step is invariably Rasayana. Rasayana again based upon the need and the etiological factor, we can select the Rasayanas. We have anyway made the Rasayanas in that also. See, whenever we say that some cortical impairment is there and the child is not responding, comprehension is not better, definitely none other than Manduka Parni or Brahmi are the better choice of made the Rasayana, because they have that property of developing the neural circuits. Then we have, if at all we have any issues or history or things like, where there could be some metabolic products which can be accumulated and we want to remove that, of course, Haritaki and Amalaki are the better things. So they will clear out the collected ama from the system. Next we have the Guduchi now, if at all any deficiency of the trace elements you suspect or you want to supplement the child with the trace elements, and if the child is presenting with agitated behaviors and all, you want serotonin and dopamine to be improved activities to balance that agitative movements, then you can select the Guduchi. And if at all the child is presenting with some seizures associated manifestations and all, and you want to have an inhibitory action, definitely Vacha is the drug of choice. These are all as per the recent research updates. And Ashwagandha induces the successful inhibition of the neurobehavioral. Too much of behavioral issues, you please introduce Ashwagandha. So this is how we have to select the method for treating the children with autism with various manifestations. As I said, tackling sensory issues is a major thing in the management of autism. So what we use, if the child is too much presenting with the tactile issues, we use things like Utsadana, Parisheka, Analepa, and later Abhyanga. Then auditory issues and all, these children respond very good with music therapy. Music therapy, there are a lot of researches I will also share with that. What we have seen is, chanting of this Gayatri mantra or chanting of this Lalita Sahasranama and all is too much calming for these children. So we ask them to put with the headphone. That is very important. If you just play the music, it's not useful. You have to put the child with a headphone and make the child to sit. So I was telling, I will show the video of the child. The child was not at all sleeping in the night. So we introduced him with this kind of this one. Then slowly he started becoming calm. So this is a part of mantra chikitsa, in fact. Then fidgeting, I know this is again another issue. They don't get the purposeful action unless until you remove the fidgeting and stimming and spinning. So sometimes, we have to be very harsh with the child. So we tie them, we lock them, and sometimes, whichever the fidgeting part is there, we do bandhana for that part. And all this, it gives, it looks, what is this? Is this a part of treatment? But, it gives wonderful results. So that could be adopted. And in case of sleep problems, of course, dhara, as I said, music with a headphone, swinging, and some vahana kind of massage, all these are going to improve the sleep issues in the child. And this is what about the Cochrane reviews regarding the music therapy in children. They have found out that Darbari ragas beneficial for autism are like Darbari, Karahara Priya, Pilahari, and Sahana. They're all too much calming down effect on the mind. So better thing is, flute music of these ragas, or the veena. Veena is again one of the wonderful things. The musical instrument, and veena, these ragas, one can play for these children and make them hear through the headphone that calms down the children. So this is what regarding the Sambodhi protocol. As soon as a child enters into our hospital, it goes for the registration. Preliminary assessment will be done by our house officers, and followed by the MChat, ISA, RTA-BC will be done with a consultant or with the postgraduate scholars. Then followed by, we advise them oral medications for about a month, 3 weeks to a month. Then they would be called for IPD management. And after this oral medication, we would definitely have a re-evaluation followed by IPD management for 2 weeks with a varied therapies. Right? So then in any of this stage, care to be taken to maintain the Agni of the child. So Agni Chikitsa is the first Chikitsa which has to be followed. And this is the protocol. So Agni Chikitsa followed by Shamana Chikitsa, Mrudu Shodhana. Usually we use Alpati Karachuna, bedtime. Then depressive child means we go with either Shodhana or Nasya. And speech and marma stimulation. Again, we're fortunate to be, given awareness regarding the use of marma points by Tirumular Varmalogy Institute, sir. So some of the marma stimulation points also we use. We use like Shrungataka marma. Then we use Shipra marma stimulations. And we use this Matruka stimulations, we use Vidura marma stimulations, then Shanka marma stimulations. So these are the things which we frequently use. Then oral medications and the other training. Of course, the child would be simultaneously asked to continue the behavior therapies, speech therapy, and occupational therapy. What happens nowadays? We have children who are frequently referred from child development unit of Bangalore. So they would be continuing the child development therapy, that is applied behavior analysis and autism therapy there, or speech therapy and occupational therapy. We'll be adding with our treatment, and since they are showing a little better compliance with this kind of treatment, so we are getting a frequent referral from them. And these are some of the videos which I would like to show. Is my time up, Doctor Reshma?
Continue, ma'am.
Yeah. Maybe I'll be taking another 5 to 6 minutes. Yeah, this is one of the cases of autism. This was a child of 6-year-old.
What are you playing? What are you playing? What is this?
Is the son of a doctor parents?
No, what are you playing?
You can observe.
In hands. You are playing in hands.
So this is, the child took around 3 sitting sittings of treatment. So you can see the improvement. The child's fidgeting, spinning, revolving, reduced, is able to sit. This is after 2 courses of treatment. Is able to count. Is following the commands of the mother. It's the individual activity.
In which you went to therapy room.
So after a few days of time, the child in the group activity, excellently involved in the group activity.
Thank you. Next, you have to share with all. Take it. Sharing. Now you eat. Give it to me. Jump. Jump. Sit. Okay. Give high five to each other. High five. High five for you. High five. Bye. Bye.
I'm a father of a 12-year child. My child is diagnosed with mild autism at the age of 3 years. So we took him to Malaysia Center for speech therapy. So I've taken treatment over 6 months over there. But the result is not satisfied. One of the colleagues said me to visit Dr. Reena Kulkerni, his everything for his kidney. His no eye contact, irregular speed, repeating goals, hyperactivity, moving here and there. So she had given treatment for 10 days with Ayurvedic medicines. He has improved a very lot in the 10 days only. His eye contact is coming on now, and his movements, irregular movements, roaming here and there, and the hyperactivity has been reduced very much. Now his sitting tolerance also improved.
So that's about, the child took around 3 to 4 sittings in our hospital and now is in a regular schooling. This is another case. Sorry. This is around 8-year-old child who visited. This child was taking, he was diagnosed as autistic and was on speech and communication therapy at All India Institute of Speech and Hearing, Mysore. Initially, they worked a lot on this child. The child's sitting tolerance, communication, and cognition could not be improved to a greater extent. So then they referred this child with one of our colleagues' contact. So they visited us. This is during the treatment. After a week's treatment, the child was able to follow the commands of the mother. And still he was a little bit hyperactive and shift of ideas were there. Purposeless movements. So now after this child, I've taken almost 2 years of treatment now. This is the latest video of the child. The child during the lockdown, child was effectively able to participate in online schooling. Then his outdoor activities, fine with outdoor activities, and latest thing he is able to follow the dictations, he is able to write, he is able to identify and give a meaningful communication, individualized activities. Most of the independence he has achieved. Of course, to some extent it needs supervision and guidance, but his routine activities the child is able to do.
Yes, sir.
He is proficient with other language also now.
Yes, sir. Next. Yes, sir.
Yes. So that's about. So we'll see one more video. This is a child, I was telling a lot of gut issues, sleep problems, hyperactivity, purposeless hand movements. You can just you cannot even make him to stand for a while. And even if you restrain him, he starts jumping. You can see his abnormal sounds. You can just see once his hands are released, the hand fidgeting. Is too much fascinated about the ball, and you can see the placement of the hand, too much issues with the hand functioning, does not respond. Of course, this was during the treatment, the video was taken. So this was the status. Now, he has taken around 6 sittings of treatment. The 6 sittings means 10 days of treatment, 6 times in our hospital for last 6 months. I think he started his treatment in last April. So you can see now he is able to sit. He follows the commands. His hand activities are better, but purposeless activities are reduced.
Very good.
He is able to
Very good.
follow the commands.
Very good. C for? Very good. Very good. And L for? Very good. And O for? Very good. And K for? W for? M for?
So this child is put into skating now, is able to manage individually in the skating. And finally, this is one of the parents of another child who was treated here.
Instead of Ayurvedic Institute, treatment self-talk
Child was having a frequent self-talk.
eye contact.
No eye contact. Sparingly she used to answer.
Self-talk almost eye contact improvement ಇದೆ. ಸೊ ಇವಾಗ ನಾವೇನಾದರೂ ಕರೆದ್ರೆ ಏನಾದರೂ ಆನ್ಸರ್ ಮಾಡ್ತಾರೆ. ಸೊ ಇವಾಗ ತುಂಬಾನೇ ಅವರಲ್ಲಿ ಚೇಂಜಸ್ ಇದೆ. ಸೊ ಯಾವಾಗ ಆಯುರ್ವೇದಿಕ್ ಟ್ರೀಟ್ಮೆಂಟ್ ತಗೊಂಡ್ಮೇಲೆ ಅಂತೂ ತುಂಬಾನೇ चेंजेस
ते गरम करून कॉईल डायरेक्ट त्यांना फाडावं लागलं, पण त्याला परत प्लास्टिक चिटकलं तर अवघड होईल. आपण पाणी बिणी गरम करतो.
Dr. Sukada, can you mute yourself?
अगरबत्ती नाही, अगरबत्ती नाही.
So with this, I would just come to the fag end of the presentation. Around 15 minutes additional time. So just to conclude, best screening tool. Child visits the hospital. What is the best screening tool? Say hi, hello, or say bye. If the child is not able to do that. Dr. Sukada, please mute yourself. Organizer, please mute Dr. Sukada. Yes. So that is the best screening tool. If the child is not able to do that, so you have to screen the child for autism. If the child's gaze, hearing, socialization, and play are limited or purposeless or not up to the mark, again, that's an indication that we have to screen the child for autism. Initiate the treatment as early as possible. If we initiate around 2 years of treatment, at least by 3 years, the child would be able to do some of the independent activities based upon the severity of the condition. Identify the harmful diet and remove it. Keep constant Agni correction. Build the confidence. Create the useful neural pathways by meaningful activities. So then, whenever, don't hesitate to restrict certain activities which are harmful or meaningless for the child. So if we do that, then only we will be able to achieve the meaningful activities in the child. Then transdisciplinary approach is very essential. Otherwise, the sum total will be less. Then keep the child engaged and take the child away from the gadgets. No TV, no mobile phone, no tab. So if the parents are able to spend the time with the child, the improvement in the child will be far, far better. And make the child to follow simple commands and physical activities. They have to make it a compulsion for the parents that they have to take the child out for half an hour to 45 minutes and take to the park, take to jogging, take to running. Such activities we have to involve, or swimming. Then only the child's sitting tolerance and improved mind gets calm. Then encourage the night abhyanga. So as Kashyapa has encouraged, Nishita Vimardanam, very important for children. So night encourage it, and dry massages to the body before bath in the morning. Then immunoboosters, Swarna Prashana, no parallel to Swarna Prashana. Swarna Prashana can be very good for Agniditya as well as Ojavardhana as well as Rasaya. So, and of course, I have to maintain the Anulomana in the child properly to have a proper functioning of the dhatus. So with these words, I thank the organizers once again for this wonderful opportunity to share some of the views. Thank you so much.
Thank you, ma'am. Very well said. Thank you, ma'am. Very well said. Without Karya Karan Bhav, autism is not possible. And you explain autism by giving various examples. Thank you so much for your presentation. It was really beneficial, ma'am. It will be useful for students as well as practitioners. Thank you for enlightening on such a subject, ma'am. Thank you so much. Moving further, now we are going to start our second session. For this, I request Dr. Ranjit Rupana sir to introduce our chief guest speaker, Dr. Gujarati sir. Please welcome, sir.
Good afternoon, everyone. Myself, Dr. Ranjit Rupner, Assistant Professor, Kaumarbhritya Department, ADMC Ashta. First of all, I would like to welcome you all once again for active participation for the today's national webinar. It's my immense pleasure to introduce speaker of our second session, Dr. Rahul H. Gujarati sir. Sir is currently working as a professor at Bharati Vidyapeeth, deemed to be University, College of Ayurveda, Pune. Sir have total 21 years of teaching experience. Sir has completed BMS from University of Pune, accomplished a master degree from Banaras Hindu University. Sir has completed diploma in yoga from BHU, granted MBA in hospital administration from Institute of Graduate Studies, Ontario, Canada. Sir has completed basic and advanced diploma in medical education and technology from Maharashtra University of Health Science, Nashik. Sir has pursued advanced training in pediatric nutrition from American Association of Pediatrics, advanced training in invasive and non-invasive neonatal and pediatric ventilation from AIIMS, New Delhi. Sir's total 21 research articles have been published in various national and international events. Sir is also delightful member of National Neonatology Forum of India and Indian Medical Association Pune chapter. Sir have contributed chapters in 2 books. Gujarati sir has been prosperous as a resource person in national and international event, All India radio station, CMEs and ROTPs. Sir has been awarded and recognized as a trainer by NARI, that is National AIDS Research Institute, for training in pediatric HIV. It's our big privilege that Dr. Gujarati sir has with us today as an eminent speaker on the topic Principles and Practice in Kaumar Panchakarma. We are excited for his words. Welcome, sir, again. Over to you, sir.
Thank you. For today's topic, we are going to discuss about something about with Panchakarma in pediatrics. Basically, till late it was thought that for except for a few specific procedures in of Panchakarma, much cannot be done. Purva Karma has been a major part which can be utilized in as Panchakarma in pediatrics. Basically, we need to differentiate what is Purva Karma and Panchakarma. Kerala Panchakarma has been implemented in the management of children. They have been using Kerala procedures for Panchakarma. They call it as Panchakarma, but if we go through it properly, most of them, they can be included not as Shodhan therapies, but they are more as of Shaman therapies, and they are more of pre-procedures. That is
Excuse me, sir.
Yeah.
Sir, audio should be a bit louder. So you are not audible.
Is that okay now?
So a bit louder, please.
Now is that okay?
Yeah, sir.
Okay. So the Kerala Panchakarmas, they are more of Purva Karmas, I would, in my personal opinion, where Abhyanga, Shiropichu, Annalep, these all procedures are performed. They are more, and they perform less of Shodhan, but they are more of Shaman type of Chikitsa. So when we speak of Panchakarma, Panchakarma is itself, in itself, is a Shodhan Upakram rather than a Shaman Upakram.
Sir, excuse me, sorry to disturb you.
Yes.
Sir, a bit more louder. It is a please.
Now, is that okay?
No, sir.
Now is that okay?
Okay, sir.
Yeah, okay. So we would talk about the Shodhan, the Purva Karmas and Pradhan Karmas, which can be implemented in children. Okay. So why is Panchakarma important in general, not only in pediatrics, but in all types of treatment? Why is Panchakarma important? Panchakarma is important because it is a dosha shodhan chikitsa. It is the way of removing unwanted, vitiated doshas from the body. Basically, there are two types of chikitsas which are performed on any individual. One is the Shaman chikitsa and one is the Shodhan chikitsa, of which Shodhan chikitsa is considered to be a Punarbhav chikitsa. And therefore, dosha Shodhan chikitsa is an important part in a Punarbhav of a specific disease. So, Panchakarma can perform that, and therefore it can be a major part of the treatment. Secondly, as I have already told, it is an Apanarbhav chikitsa. It is also a Sadhyo Phaladai chikitsa. It brings about a change in the body. It brings about homeostasis immediately after the procedure, because we are removing, rather than trying to pacify the doshas, we are trying to eliminate those doshas. Therefore, it is a more of a emergency treatment. It is more of an Sadhya Phaladai chikitsa. It can be also used in emergencies, where we can use I personally use mostly in treatment of Tamaka Shwasa as an emergency treatment. We can use those as emergency treatment. The spectrum of the treatment is much bigger for Shodhan Chikitsa. Then Sthanik and Sarvadayik Vyadhi Prashaman can be performed by Shodhan Chikitsa, and it is a treatment where we are using multiple drugs on we have a multiple choice of procedures to be performed on a child. Now, what is the difference basically in terms of treatment in between adults and children? For adults, we know the treatment principles, but for children, there are some different principles we have to keep in mind before starting any treatment. What is the basic difference? A child is having a growing body, he is growing in the growing ages. So he has a Vardhaman Sharir. The body is going to keep on growing. The dhatus are going to keep on growing. They have not reached, or they have not attained a Sampurna Virya Avastha. They are not completely Balavan, because of which we can include or induce severe treatment modalities in that. One. Secondly, it is very difficult to diagnose a disease in children. The reason, children cannot express themselves completely. So most of the time we need to assume and we need to make a diagnosis accordingly. For that, to aid our diagnosis, other than darshan and sparshan pariksha, because prashna is not that much of importance, prashna goes to the third party, the mother or the caretaker, who will inform us, but the exact answer is not possible. For that, we have something known as in Kashyap, the Vednadhyay, which can help us aiding the diagnosis. Thirdly, there is a difference of ahar of an adult and a child. The child ahar is mostly ekarasatmak. He prefers to eat some specific foods only. As compared to an adult, they are mostly shadrasatmak. Fourthly, the child is alpasattva. He is bhiru. He cannot immediately accept things, neither can he forego things for, or he cannot immediately accept the treatment also. So we need to first pacify the child, we need to make him calm, and then we can go for a further treatment. Then a part of chikitsa is utilizing pathya and apathya. We need to explain the patient what is apathya and what he should not follow, what things should be discontinued. For an adult, it is quite difficult, easy to accept those things, and his acceptance towards the treatment and the apatya ahar. But for a child, it becomes difficult because he might insist on eating something. He might insist on some specific vihar. So those things, they are difficult for us to get used to that. Then Prakriti Vinishchay, because treatment, any Shodhan treatment or any shaman treatment would basically follow the Prakriti principles of a person. Now, because it is difficult, because Prashna Pariksha is quite difficult in a child, Prakriti Vinishchay is also difficult for a child at any cost. So initiating a treatment will also be difficult. Then using Aushadhi Kalpana. Aushadhi, most of them, they are Tikshna, they are Tikta Rasatmak, Tikshna and Ushna in Virya. There are some Madhur Rasatmak, but most of the Aushadhis, they are Katu Tikta Kashaya Rasatmak, and acceptance of these medicines is difficult by a child. So we need to prepare different types of formulations which can be utilized in a child. Even we keep on changing the formulations, it is the child may not accept the formula which we have derived or which we are administering. The adult may accept it, because the child does not accept it because we are unable to suppress the tikta ras of the medicine. So it becomes difficult for administering the medicine. And for a child, because the dhatu bal is less, the child lands up immediately into complications, which doesn't happen with adults. So these things we need to consider while going for treatment of a child. Now, when we speak of Shodhan Upchar, we need to know that Shodhan, there are 5 types. The names may be different according to different Samhitas, but basically there are 5 types of Shodhan: Vaman, Virechan, Niruha Basti, Anuasan Basti, or we will consider those 2 together as Basti, Nasya and Rakta Moksha. Of these, Siraved or Rakta Moksha have been completely contraindicated in children. I would say Rakta Moksha by Siraved is completely contraindicated if we go for cross-referencing. Up to a certain age, Rakta Moksha is not allowed. But after that, we can go for a minimal Rakta Moksha, but not by Siraved. The rest 5, Vaman, Virechan, Basti and Nasya, can be utilized or can be performed in a child depending upon the condition of the disease and depending upon the acceptance and the state of that patient at that moment. Now there are some principles of Shodhan Upachar. In the first year of life, no Shodhan Upakram has to be performed. The children cannot be exposed to Shodhan Upakram. The first Shodhan Upakram what we do in a child is at birth, but it is a mini Shodhan. we go for Garbhodak Vaman, and we have called it as Prachardan but not Vaman. The Prachardan part is done at birth, but no other Shodhana Upchar, neither again a Prachardan is continued in the first year of life. No Shodhan has to be done. Secondly, of the 5 Shodhan Upakram, Basti has been advocated from birth till death. So Basti can be implemented in any time of the any span of the age. But remember, again in first year of life, no Shodhan Basti can be given. We cannot give Asthapan Basti, or we cannot give Shodhan Basti. Yes, we can give Matra Basti. The dosage can be calculated accordingly. Like Basti, Navan Nasya, or what we call it as Sneha Nasya, can be utilized throughout life. It is said, Ajanma Maranam Shastam Pratimarshastu Bastivat. So, Pratimarsha Nasya, that is Navan Nasya, and Sneha Basti can be utilized throughout life. And if we are going to use Shodhan, we need to first compile, and we need to first finalize the drugs for the treatment, because we cannot use Tivra Shodhan, or we cannot use Shodhan which is really going to damage the child, because the child does not have those much amount of Dosha Bala and also Dhatu Bala. So what can be done in a child when we need to go for Shodhan Upakram? One, we need to remember that because in the first year of life, we are unable to give any Shodhan Karma to the child, and because the child is completely dependent on the lactating mother or the Dhatri for its food. So the dosha sanchay which happens, the vitiation which happens in a child will be completely dependent on the mother. And therefore, in the first year of life, where we cannot go for Shodhan Chikitsa in a child, we need to go for Shodhan Chikitsa of a mother. Nityam Dhatri Samshodhayat. The Dhatri should be exposed to Shodhan Chikitsa. But again, to remember that the Dhatri cannot be exposed to Samshodhan, Tivra Samshodhan. Yes, recurrent but mild Samshodhan can be done. In a child, if we need to go for Shodhan, the Shodhan Chikitsa should be accompanied with partial Bruhan and or Yapan, which cannot be single-handedly Shodhan Chikitsa. Before performing the Shodhan Chikitsa, we have to think of Purva Karma, because Shodhan is going to hamper the Dhatu Bala. The Purva Karma will help in maintaining the Dhatu Bal up to a certain limit. Can we replace the karmas? Instead of Vaman, can we use Virechan? Instead of Virechan, can we use Vaman? These interchangeability has to be thought of while implementing Shodhan Vishishta Karma. And for a child, we need to think for, and we need to plan for Vishishta Paschat Karma. Not just Samsarjan Karma is adequate, but we need to go for other Paschat Karma also. So for Purva Karma, for every Purva Pradhan Karma, that is Shodhan Karma, we need to undergo 2 Purva Karmas. One is Snehan and one is Svedam. For Snehan, we have 2 types of Snehan. One is Achha Sneha and one is Vicharna. For a child who is less than 6 years, never give Achha Sneha. There are 2 types of only Sneha to be given. One is Keval Sneha and one is Achha Sneha. Achha Sneha is ingesting or administering Sneha through the oral route or through the GI tract. Through the oral route, I would say it is much specific. So Achha Sneha cannot be given to a child and should not be given to a child who is less than 6 years of age. For a child who needs to be given Sneha, should be always Vicharna. Vicharna Sneha is mixing of Sneha along with some Peya or Vilepi or Anna, so that helps in Sadhya Snehan of the child. because it is mixed with ahar. The ahar is going to convert itself into rasadhatu, and rasadhatu is going to go for portion of all the dhatus, and therefore along with that sneha will go for up to the micro srotasas, where it will cause snehan of each and every dhatu point. So vicharna sneha should always be thought of and should always be preferred for snehan upakram. If you have to use after 6 years again, if we have to use acha sneha, that is we have to administer sneha orally, the maximum amount, the maximum dose of sneha which can be used is the hina matra, that means which gets digested in 3 hours. So if a child can digest only 20 ml in 3 hours, that is the uttam matra. That is the only matra, maximum matra which we can give. If the child is able to digest only 10 ml, that will be the only maximum dose which we can give. The maximum dose of hin matra can be not more than ardhapala. So the rule comes up over here that no acha sneha up to 6 years of age. After that, if we need to give it in hina matra, which is digestible in 3 hours. And after that, if it is being digested before that, even then the maximum dose should be not more than ardhapala. We have 4 types of snehas which can be given for snehan: Ghruta, Taila, Majja and Vasa. Of this, a child should be given only Ghrutapan, no Taila, no Majja, no Vasa, because
Sir, you are not audible.
बोला राजवर्धन.
Please unmute, sir.
is that audible now?
Yes, sir.
Okay. Sorry, I had some network issue. So
Share screen, sir. Please do share your screen, sir.
yeah, just a moment. The screen is visible probably now.
Yes, sir.
Yeah. So only sneha pan, sadhya sneha are to be utilized when we are going to go for a sneha pan. The next one goes as Purva Karma for Snehan is, if you need to go for Kevala Sneha, the most preferred route is Anuvasan Basti. You can give only Sneha for complete oleation of the body as a Basti, Sneha Basti or Matra Basti. That can be performed regularly so that the child always requires less amount of sneha, the dose of sneha, because the child already is snigdha. One. Secondly, if we need to go for, if the child is not accepting basti or if the child is not ready for basti, abhyanga can be used, which can help in going for sneha, which will be adequate for sneha. Anuvasan basti is the best. We had done some experiments in children also and in adults also, where we had tested whether Anuvasan Basti can bring about adequate snehan as by oral snehan, and it has been found that oral sneha and Anuvasan sneha both are at, again like adults, we should not administer sneha from both the roots, from the mouth and from the anus. Even vicharna should not be administered when you are giving Anuvasan Basti. Who should not be given Sneha? Ati Bala, that is a child below 6 years of age, who has been given Anuvasan Basti or who has been given Snigdhanasya, a child suffering from Jwara, a child who has got GIT issues, a child who has got Udar Rog, and a child who is Soshit. Only these 6 people or these 6 categories, they have been contraindicated for Snehan. Post Snehan comes up Svedan. A child again cannot be given Svedan like a adult. So Mrudu Swed has been administered for a child. For Mrudu Swed, we have to use Snigdha Swed by using the Snigdha Swed can be like of Annalepan, it can be like Pishinchil, it can be like warm Abhyanga. These are all types of Mrudu Swedas. So we can use these kind of Swed or we can use this Snigdha Swed. Of the Ashtavid Sneha, which Sweda which have been advocated by Kashyap, Hasta Swed and Pata Swed, they are the most important part, or they are the most important or the most preferred type of Svedan as told by Kashyap. Hasta Swed and Pata Swed, they should be used or they should be performed for a child who requires Svedan. Up to 4 months of age, if we need to give Svedan, we can give only Hasta Swed, not even Pata Swed. Below 6 years, below 1 year, we are not going to give Snehan at all. We are not going to go for Shodhan at all. But for Dosha Sanchaya, Dosha Marga Kraman, we need to give them Svedan. We can give Svedan without Snehan up to 1 year of age. I have already told that for Snigdha Swed and Mrudu Swed, we can use Pradeha, Annalep, Pinda Swed, Avgaha. After 1 year of age or after 6 years of age, we can go for Nadi and Upanaha, not before that. Pradeha, Prastara, they should be generally prevented up to 6 years of age, but if required, they can be utilized as Ruksha Swed. If we are going to use Pradeha and Prastara Swed, they should be generally used if a child is suffering from Urdhva Jatrugata Vikar. Pradeha can be also used if we are expecting Vaman to be done, where Urasthan needs more of Svedan. Snigdha Swed is something where we can skip Snehan and give Svedan, so that the procedure of Snehan or complications of Snehan in a child can be prevented. Annal Svedan, Pinda Swed, Annalep, these are all more of Shaman type of Svedan and they cause Bruhan. So they are not utilized for Shodhan Chikitsa. A child who is hungry, who is thirsty, should not be given Svedan. A child who is suffering from diarrhea or who is Shoshita or who is suffering from Udara Vyadhi should not be given or should not be introduced to Svedan. Which diseases in child are specifically advocated for Shodhan. Kashyap says Jwara is the most important disease where we can go for Shodhan. Shwasa, Kasa, Pratishya and Hikka. That means these are all related to the Pranavaha Srotas. Visarpa, Kushtha, Kamala, Pliha, Pidaka of the Raktavaha Srotas. Anaha, Malagraha, Krumi, Dantarog. These are of the Annavaha Srotas. Udarshul, Apasmar, Vata Vyadhi, Graha Vyadhi. These are all those Vyadhis where we can go for Shodhan Chikitsa. As I told in the previous slide, below 6 years,
Sir, do unmute, please.
is it okay now?
Yes.
The slides are also visible?
No, sir.
I'm sorry for the disturbance, but I don't know what's going wrong. Yeah. So before 6 years of age, woman should not be given. If we have to give, it should be a Mrudu woman, that too with Lavanodaka, or using medicines like Indrayav, Saindav, Pippali, or Apamara. It should be mostly Prachardan, or what we call it as Sadhya woman.
Sir, you are not audible.
For an adult, we use Dupan for after as a Paschatkarma of woman. For a child, we cannot use it, and for that we should use more of Ushnodak or Panchakolpeya for as a Paschatkarma. We should, as I have already spoken, we need to use only Ushnodak or Lavanodak for woman, and before woman, we should go for Patasved. Virechan is quite easier than woman, and it is useful in multiple diseases also. According to Akbhat, Virechan cannot be given to a child who is less than 10 years of age. But instead of Virechan, we have 4 types of Virechan, or we can make it into, we can divide it into 4 according to Sharangar. So of those 4, in a child, we can use Anuloman and Srausan. Even Charaka has in Kalpasthan has dedicated one full adhyay on Srausan or using Aragvad, which can be used in children. And Charaka has specifically mentioned that this Aragvad can be used for children for Virechan. So we can use Anuloman and Srausan Rarely, if the child has got a good bala, we can use Sukha Virechan by Trivrut. We should not use Bhedan or Tivra Virechan. Most of the times we need to use Snigdha Dravya, and therefore we should use Snigdha Virechak Gruta for Virechan. If we are giving Churna or Kwat, then it should be given along with butter, Aushadhi Pan. After Aushadhi Sevan, we should give Mukha Sinchan. We should clean the face, or we should sprinkle water on the face, because many a times Virechan Aushadhi itself can cause Vaman. So to prevent that, one should go for sprinkling of cold water on the face. And like Vaman, we need to give Panchakarma to Virechan in the type of Sansarjan Kram. Vaman and Virechan, they form a short part of Shodhan Chikitsa in pediatrics as compared to adults. Half of the Chikitsa, or I would say 3/4 of the Chikitsa, is Basti in children. Because according to Charak, or according to Vagbhat also, they have already stated that if in a disease we can use Vaman and Virechan both, instead of Vaman, prefer Virechana in children. If we can use Virechan and Basti for the treatment of the same disease in children, instead of Virechan, prefer Basti. So Basti can be used for all types of diseases where you require Shodhan Chikitsa, one. Secondly, Basti can be used in children right from the age of 1 year up to the age of 70 years. So Basti can be utilized everywhere in all age groups. So Basti forms half of the part of Shodhan Chikitsa. So it is the most important Chikitsa of Shodhan Chikitsa in children. Why? Because it is Ajanma Satmya. It is Ajanma Shasta, both Satmya also and Shasta also. It is Anapai. It doesn't create any complications. It has got Sneha in it. So it is a Snigdha Shodhan. For children, it is the best treatment modality. Then it has got, it can be utilized for both the treatments, Shodhan also and Bruhan also. So we can use Basti throughout. We have got different types of Bastis. Matra Basti can be used since birth. Asthapan Basti or Shodhan Basti only once the child has attained 1 year of age, not before that. Because Asthapan is at 1 year of age, Anuvasan again starts at 1 year of age. There is a difference between Matra Basti and Anuvasan Basti. And for children below 16 years of age, Uttar Basti should not be utilized. Now we have learned in Ashtang Hrudaya, we have learned that the Karma Basti, we have Kala Basti, we have Yoga Basti. But the way which we utilized Matra Basti, Karma Basti, the division of it is totally different according to Kashyap. In Kashyap Samhita, Karma Basti, the total number is 30. But the number of Matra Anuvasan Bastis and Shodhan Basti, they are different. For Karma Basti, there are 30 Bastis in total. The modality includes 30 Bastis, but before starting Basti, we need to give 5 Anuvasan. In adults, or according to Charak Vagbhat, we had to give the first one as only 1 Anuvasan Basti. Then it was Vyatyasat Niruha Anuvasan. But in Kashyap, we need to give 5 Anuvasan Basti in the beginning, then 1 Niruha, then again 3 Anuvasan. So 1 Shodhan, 3 Anuvasan. Like this, we have to go for 6 cycle, and at the end, only 1 Anuvasan Basti. That makes out to be 30 Basti. Similarly for Kala Basti, 3 Anuvasan in the beginning, then 3 cycles of 1 Niruha and 3 Anuvasan, and 1 last one as Anuvasan. In Yoga Basti, the number is same, 8. But every time, 1 Anuvasan in the beginning, 1 Niruha, then 1 Anuvasan, 3 cycles, and at the end, 1 Anuvasan. So these are this is the biggest difference. Why 3 Anuasan for every 1 Niruha Basti? Because Niruha is Shodhan type. Anuvasan is Poshan type. Anuvasan is Snigdha. Anuvasan is Balya. So to bring back the Bala of a child to normal, to back to the previous thing, Dhatu Bala, we need to give more of Anuvasan. So there are less amount of Niruha and more number of Anuvasan Basti. There is a 4th type of Basti compilation according to Kashyap, that is the Chaturbhadra Basti, which includes 12 Basti, where we need to give 4 Anuvasan in the beginning, 4 Niruha directly one after one every day, and 4 Anuvasan. These are, but this has to be advocated or this has to be performed only in children who are more than 10 years of age. Now in adults and children, there are some changes in the rules. For an adult, the Anuvasan Basti is to be given Ardra Pani. That means once you have given Niruha Basti, the Bastis comes out, the Basti is expelled out, there is Dosha Shodhan, immediately you ask the patient to go for full diet, and once he finishes his diet, you immediately go for Anuvasan Basti. This is the routine procedure for performing Basti in adults. But in children, 2 Bastis cannot be given on the same day. So today Niruha, tomorrow Anuvasan, day after tomorrow Anuvasan. On one single day, only one single Basti has to be given, even if it is a Sneha Basti. One. Secondly, you cannot give, except for Chaturbhadra Basti, you cannot give the same type of Basti every day for more than 7 days. Because if you give more than 7 days, even in Chaturbhadra Basti, we have seen that there are only 4 Matra Bastis, as 4 Anuvasan Bastis and 4 Niruha Bastis. So no same type of Basti should be given for more than 7 days, because there can be other complications. Like if you use Asthapan Basti daily, it can cause Vata Prakop. If you use Anuvasan Basti daily for more than 7 days, it can cause Agni Mandya. Except for Matra Basti, all the Bastis have to be given only maximum 7 days in a row. The third difference is the amount of Sneha Basti. For adults, it was like 1/4 of the Niruha Matra is considered for Anuvasan. But in children, we need more of Snehan. And therefore, the Matra of Anuvasan Basti should be 1/3, not lesser than that. So Anuvasan Basti should always be 1/3 of Matra Basti. So in an adult, if we are giving 960 ml of Asthapan Basti, then the Anuvasan Basti was 240 ml. But in a child, if we are going to give 960 ml of Niruha Basti, the Anuvasan Basti should be of 320 ml. 1/4 of 1/6 of Anuvasan should be the Matra of Matra Basti. And
Sir, you are not audible.
then for Pitta Rog, the Matra of Sneha should be 1/6. And for Kapha Rog, it should be 1/8. Now, what I spoke initially, this is the same thing. If the Matra of Niruha Basti is 30 ml, the Anuvasan should be 10 ml. This is the chart of how it should be done. Nasya Vidhi, Urdhva Chaturugat Vikar, the preferred Shodhan is Nasya, and that should be a type of Bruhan Nasya, Shodhan Nasya, or Shaman Nasya only with Sneha. Before that, we need to go for Sthanik Snehan and Svedan. And for a child, we can utilize only Pratimarsha Nasya, not Marsha Nasya. Shodhan Nasya is totally contraindicated. So the dose of Pratimarsha Nasya is 1 or 2 drops, not more than that. No Swaras, no Avapidan should be utilized. Only Sneha should be utilized for Nasya. Before 7 years of age, Marsha Nasya should not be given. After 7 years, you can give Marsha Nasya with Mrudu Aushadhi, not at all Tikshna Aushadhi. For Shodhan, again, as I spoke, it should be Siddha Sneha. It should be Madhu or Sendha with Swaras, not more than that. But the preferred drug for Shodhan Nasya is Purana Ghruta. Sarshaptail can be used, but it should be a Purana Sarshaptail, and Shodhan Nasya should be done every 3rd day. I would say every 4th day, a Vyatyas of 3 days. Again, the same thing, Pratimarsha Nasya can be done since birth every day. Shaman and Bruhan can be utilized for that. Done by Marsha Nasya, Pratimarsha Nasya, sorry. And why Pratimarsha Nasya can be utilized? The reason, Pratimarsha Nasya has got multiple times where we can give it. Whereas Shodhan, we know that according to Vagbhat, there are 15 times of a day where we can utilize Pratimarsha Nasya, whereas there are only 8 times where we can use Shodhan Nasya. Nasya Kal, what we call it as. So, in short, when we are going to implement Shodhan Chikitsa in children, we need to first see whether it is really necessary for a child to use Shodhan Nasya, whether we can implement Shodhan Nasya. We should see whether the child is eligible for that. And before implementing or before going for any Shodhan Nasya, we should go for a proper Purva Karma so that the bala of a child is always maintained over there. We should use Snigdha Dravyas for Shodhan. Snigdha Dravyas is the most necessity for any type of Shodhan. You cannot go for Ruksha Shodhan, and Samsarjan Kram, like adults, has to be performed in children also. Children might land up into Atiyog very fast. So the Virya of the Aushadhi which we are going to use for Shodhan should be Mrudu Virya. Places where we can use Vaman and Virechan, both prefer Virechan. Where we can use Virechan and Basti, prefer Basti. Where you can use Pratimarsha and Marsha, prefer Pratimarsha Nasya. Don't use or don't perform Raktamokshan. Now, one part over here I would say, Saktamokshan should not be done because we are removing the Dhatu, we are removing the Poshak part. But if Raktamokshan is advocated or is necessary, go for Jalauka Charan and not Siravid. Thank you.
Thank you, sir.
I'm sorry for what the network issues.
No problem.
No problem, sir. So thank you so much for your presentation. Having healthy child is our first priority. So as it gives a healthy society, so it was a need to have more enhancing knowledge regarding Kaumarbhritya Panchakarma. So thank you so much again, sir.
Thank you. Thank
you. Now I request Coordinator and Associate Professor of Kaumarbhritya Department, Dr. Anjali Kamath ma'am, to introduce MUHS Observer, Dr. T.Y. Swami sir, for his valuable words. Please welcome ma'am. Good afternoon, everybody.
I am here to introduce our observer appointed by Maharashtra University of Health Sciences, Dr. T.Y. Swami sir. Sir has done his BMS from Kakatiya University, Warangal in 1986, MD from Banaras Hindu University, Varanasi, 1989, PhD from again Banaras Hindu University, Varanasi, 1994. He is also approved PhD guide by MUHS Nasik. His research experience is efficacy of syrup Apitol in appetite of children. Duration 2 years from 2014 to 2015. It was done, the research was conducted in Government Ayurved College, Usmanabad. And there is one more research in the pipeline, study the effect of Sudarshan Dhanavati in COVID-19 pediatric population. His other experience includes total teaching experience of 27 years. Thesis, he has guided more than 28 theses. He has presented more than 40 papers. He has chaired more than 14 seminars, publication of papers more than 25. He was a resource person for ROTP at more than 10 events. He is a guest speaker for CCRAS academic bodies. He is administrative board of studies member, selection committee member, board of studies, Dr. Babasaheb Ambedkar, Maratha University, Aurangabad, and subject expert for Maharashtra University of Health Sciences. He has also conducted many workshops on neuromotor disorders and therapeutic approach. He has exceptional experience and research in cerebral palsy children. He has also established a special Panchakarma department. Right now, he is deputed as professor and HOD, Kaumarbhritya department at R.A. Poddar Government Medical College, Mumbai. Welcome, sir, for your observations.
Thank you, madam. Am I audible? Hello.
Yes, sir. Yes, sir, you're audible, sir.
A lot of effort has been taken by the college for conducting this program, and I am very keen to listen Mrs. Reena Kulkerni, renowned as well as Das sir and Gujarati sir. However, as an observer, I am bound to give what you call format to the university that I will provide it. The main thing is that in spite of all efforts, this online classes has definitely had some sort of technical issues, and the quality in spite of high-speed networks, the quality is bound to hamper somewhere. So this thing, yeah.
You can start your video also, if possible.
Okay, it's all right. I mean, I think it will be convenient for me to this one.
Okay, sir. Anyway.
I'm on the journey.
Yes. Okay, sir. No problem.
Okay. So, madam, I will be forwarding this formality to the university, but your efforts are appreciable, and I wish all the delegates might have been benefited by this talks of experts, and I am very thankful for the efforts taken by the speakers as well as the college, and I thank one and all, and also to the university for appointing an observer, and I wish the college, I was to the college many times as an inspection committee member, examiner, and many more, and I know well the college infrastructure and everything, and I wish you all the best, madam. Thank you, everybody. Thank you. Okay.
Thank you very much, sir, for your comments and observations. Now I call on our assistant professor, Now I call on our Assistant Professor, Dr. Reshma Dere Madam, for vote of thanks.
Lot of thanks to Honorable Annasaheb Dange, Chairman, respected Advocate Rajendra Dange, Secretary, Professor Dr. R.A. Kanai Sir, Principal Dr. Wali Sir for their valuable guidance and motivation, Chief Guest Dr. P.K.Das Sir, Dr. Reena Kulkerni Ma'am and Dr. Rahul Gujrati Sir as a guest speaker, MUHS Observer Dr. T.Y. Swami Sir, all participants, all faculty members, non-teaching staff of ADMC Ashta, and lastly, Mr. Rajavardhan Shinde Sir for his valuable technical support. I thank you very much to all of you for joining this webinar. Thank you.
Thank you everyone for joining us. Good afternoon. Feedback form link will be provided in YouTube description box. Please subscribe it. Thank you so much for joining us. Thank you.